All right. Welcome, everyone, to the Region 2 Planning and Policy Council meeting. My name is Kirby Fye with the department. Just a few things to go over before we get this meeting started. As you may be aware, the governor's executive order was not extended. However, the council determined that due to the continuation of the COVID-19 pandemic and the need to ensure a safe and healthy meeting environment, this meeting would still need to be held virtually via the Open Meetings Act. So just as before with the executive order, this meeting will be recorded and will be posted to the department website within the next day or two. Please remember to keep your phone or computer muted before speaking or presenting. Please state your name. It's helpful with the minutes. I know, Chris, you've been keeping track of individuals who have joined the call, but I'm going to go ahead and go through attendance again, and then I'll hand it over to you, Mary Nell.
Okay.
So like I said, I'm Kirby Fye. I'm here with the department. I have Amanda Millsaps, Avis Easley, also with the department, Ben Harrington. It says Blake Price, but it's Alicia Price, correct?
Yes, that's correct.
Okay, thought I heard that. Brian Buck, Jan Kegel, Karen Broadnax, Allie Cohn, Daniel Ellis, Heather Vestal, Gina Steele-Mack, Chris Roberts, Kubra Urcal Bryant, Kurt Hippel with the department, Mary Linden, Mary Katsikas, Mary Nell Osborne. Mel, can you state your last name, please?
Whaley, W-H-A-L-E-Y.
Okay, hold on. Michelle Troppeter, Mindy Grimm. Hold on, Amy Olson. Pam, can you state your last name?
Dixon.
Dixon?
Yes.
Tammy Wilson. And I know, Pam, you joined via the call too. There's one other person that called. Can you state your name, the 865 number?
Tammy Summers.
Tammy, welcome. All right, Mary Nell.
Great. Well, thanks everybody for being here. And we do have a person on site at Helen Ross. So thank you, Mary. Thank you for that. Because that is also a requirement so we can be virtual. So thank you for that. And thank you to Chris Roberts again, our devoted and dedicated secretary who keeps me in line and organized. I sent out membership applications this morning to everybody. If you just have a moment to update any information or resubmit that, we need those, is that correct, every year, Kirby?
So it's not required. Every council does it differently. You really only need to fill it out one time, just so long as you're keeping track of it for your membership list. Some councils redo them every year because information changes. So it's really whatever your preference is.
Yeah, I know we do have some new participants. If you've recently filled one out, please go ahead and do so. If you haven't filled one out in 100 years, go on and do that for us again, and we'll make sure we have all the current emails and phones and things that you're using these days. Let's see, anybody who is new to this meeting, I want to give you a chance to speak up. The names all sounded pretty familiar.
This is Tammy Wilson with Tennessee Voices, and it's the first time that I've been able to attend. So
Wonderful. Thank you. Thanks for getting here. We're glad to have Tennessee Voices on board. Let's see. I think I need to turn it over to Chris to review the minutes from February.
Okay, I sent those way back in February to Mary Nell for review, and as far as I know, Mary Nell sent those out to everybody to look at.
Yeah.
So if there's any corrections, I need to know about those.
I think I sent a correction, just that I needed to be added as a member for the adult committee. But that was it. They look great other than that.
Okay.
Thank you, Daniel.
Thank you.
Any other comments? Can I have a motion to approve the minutes as written with that correction in mind?
So moved.
And a second? There you go.
Okay. Who made the motion?
Daniel
Daniel. Oh,
and Ben seconded. Okay, do you have anything else for us, Chris?
well, I'll go ahead and say this now, since I probably won't speak a whole lot the rest of the meeting. I will be changing job positions at the beginning of June, but I don't squeak like that, Mary Nell. I chose Kirby and I can remain secretary. So, but I will be changing job positions, but it's going to allow me still to flex to participate in this. So just an eye on that.
Well, I am very grateful that that is happening. I hope that's a good transition for you.
I think so. I'm going to be grandma. So
That's your transition?
well, I want to work closer to home. I'll still have clients in the Knoxville area though.
So that's the reason. Okay. Yeah. Motivation. Well, congratulations on that. Okay. Well, I'm going to move on down the agenda a little bit. Kirby, the next thing I have on my agenda is to review the needs assessment that we submitted to the state. Thanks everybody who sent in their votes for the mental health issue.
Hair to be in the moment versus worrying about, okay,
can you please
now
mute your
what's
phone? There's
cremated
someone
versus
not
having a
muted.
traditional burial. What are other things that he has not communicated that I need to be aware of? So please, if you have not done your
Anyone, someone's not muted.
It's called the gift initiative because it's providing the gift
I know who it
to your
is.
family about what your personal values, your
Hello?
preferences, what your future medical.
The
care
host
wishes
should
need to
be able to mute the
Oh, this
person
popped
who is
up.
not muted.
Yeah, I'm trying to find out who it is. Okay, found it. Okay,
Thanks.
so what I'll do, Mary Nell, is I will pull up the needs assessment in a shared document, and then if you want to go through them, let me get this. We can. Hold on one second. Let me pull it up.
Just while she's doing that, I want to thank everybody for their really good work on this, hard work. I think we have 4 really timely and important needs identified, and they were well researched. So thanks everybody who worked on that. Great. All right, the first 2 are mental health needs, of course. We all know that there's a shortage in the workforce in mental health, and we are identifying that as a need. I believe we brought it up in last year's as well. But it has to do with the reimbursement rates and money that people are being paid. It's a tough job. If you've done it as a career, I've got 29 years in the field, and it's every one of these gray hairs. So I think there's good data with that one. It certainly is a need. The second mental health need is to increase school-based behavioral health supports, and especially with kids returning to in-school and even kids who are online for school. We are seeing a flooding of children with behavioral mental health issues And we need to have some support on the front line with that, increasing school-based behavioral health support. So that is included in the 3-year plan, but it's not on a larger scale. So if you can read the details in there. Let's go on to the substance abuse. Increase funding to establish residential and detox treatment beds in Region 2. We know we have a shortage of beds. They did a really good job. The Substance Abuse Committee did a great job, I think, in really getting into the data and presenting in a way that shows our lack of resources. Everybody who works in an agency understands the challenge of finding folks a bed to detox and residential treatment bed. There's just not enough. And then the second substance abuse was to create more accurate and timely data on fatal and non-fatal overdoses. I think this came from folks who are very familiar with overdose databases, obviously, but that this is a need that they have so that they can account for what's going on in our community, more accurately represent it. So again, I think it's a well-researched and identified need that specifically needs to be addressed. So these are the four needs that were submitted to the state. Are there any questions or comments around these?
No, those seem like exceptional needs. I wish we could submit more. Is there a reason that we stick with 4? There probably is, just asking.
Good question. Kirby, I'm gonna let you answer it.
I really can't answer that. Since I've been working there, it's been 2 for 2 mental health and 2 substance abuse need for every regional council. So there's 7 regional councils, and then there's 3 statewide committees that also participate in it. So I imagine that there needs to be some type of limit. Otherwise the document could get a little out of hand.
Hey, yeah, Kirby, this is Kurt. Daniel, I can answer that question. It's about prioritization. There's always going to be, in any field that you are involved in, going to be needs and wants. And so this is the legislature's way of setting up a system for the regional councils to let the legislature and the governor and the department know what the most pressing needs are each year.
Kurt, can you go on and speak to, well, you kind of did. For folks that are not familiar with what happens after this, we've submitted them, other region committees have submitted their needs, then what happens?
What happens next is the needs will go to Matt Yancey for review, will go to Commissioner Williams for review, then they will be shared on our website. Actually before that, I believe the planning committee for the statewide council will review the needs as well. And then they'll be posted on our website and shared with department division leaders. And we will use those needs in the development of the department's annual 3-year plan.
Thank you. So that's the whole purpose of our doing this work and our involvement. And it's important. It's more important to me, right? I think now with, coming out of this pandemic, well, if we are coming out, continuing to recover and reinvent ourselves. That's what I was thinking before this meeting, is how things are going to change. I hope that we can continue virtual services. For some of our rural communities, it has been a real good thing. And, folks who are getting on a van and riding 4 hours for a 15-20-minute appointment through the hillside, they are really appreciative of the opportunity to be virtual. Any other comments about the needs assessment that the committee, the Region 2 group put forward?
This is Mel. I did have one comment that I do know in the past some other regional committees have not submitted things before, and I'm wondering if there was an instance to where maybe some other committees didn't sit anything, then maybe there may be an exception for us to submit more from our region.
Okay.
Hey Mel, this is Kurt. I think that you're mixing this needs assessment up with the legislative proposal process. To my knowledge, every regional council submits their 4 needs each year. So there's not a we want to keep that fair across the 4 regions. So there's not an opportunity for Region 2 to submit more needs. First of all, because every region, to my knowledge, is submitting 4 needs. And also we want to be equitable in the needs that are submitted.
I guess just to address that again, given the overwhelming, we have a provider-based council more than an individual served or advocacy organizations kind of across the state in each region. And so I'm wondering if it would make it more accessible to those groups of folks who, because they are not as well represented on the council, might be understandably outvoted, to just increase that for each region to 3 for each. Mental health 3, substance abuse 3. That way you get more accurate
Daniel,
information.
that's a great idea. You remind me of the people who want to expand the college football playoff every year, or the NCAA basketball tournament.
More football.
At some point, we've got to have a cutoff.
Absolutely, I'd say it just.
And it's about prioritization again,
as opposed to 2. But
I think
why not 4, 5, 6, 7, or 8?
Well, and I will say too,
that's
Daniel,
funny.
I will say too that every regional council looks different. We encourage every regional council to strive to have at least 51% membership of service recipients and family members. Obviously, not every regional council looks that way. It's something to strive for. So it's really a goal of the regional councils to encourage more membership of individuals that represent service recipients and families of service recipients.
True, but we've just seen this year that language has become more permissive and less mandatory. So I definitely agree that is a goal, and I would just encourage that a slight appropriate expansion be considered so that you're actually representing the needs of your members more fully. But anyhow, I don't want to hold this up.
Daniel, would you want to use one of Region 2's needs to suggest that there be more needs that can be suggested? Would you like to use one of the 4 slots for that?
I don't think that would be appropriate.
Is that a motion?
I don't think that would be appropriate, but I don't just think that the needs that have already been identified, we're working within the constraints the department has put into place, Kurt. And I don't want to subvert my colleagues' voting on those needs, which I think are very important priorities. But I would just encourage you to take back to your superiors the idea of being a more transparent, accessible, democratic listening organization by expanding that list reasonably and moderately from 4 to 6. I don't think that's a scary amount of work, but I'll leave it to you.
Okay, I'm gonna recognize.
Mary, now, do you mind if I respond to that?
You can respond, Daniel, and then we're going to hear from Ben.
Absolutely. I appreciate your suggestion. It's one that my superiors are aware of. It's been made in the past, and we get back to what we need to, or what the department feels, and how the system has been set up, is to enable the regions to deliberate, to decide and prioritize on what the most pressing needs are. This doesn't keep the regions from working in their own communities. They are community-based to promote those needs. I know Ben is one of the individuals in that region that is down at the legislature and making suggestions to state officials and to state legislators about the needs that impact Region 2. But these are the needs that are prioritized by each region to have the greatest impact and say, this is what we really need and what we would like y'all to consider when you're drafting the 3-year plan.
Mayor Nell, this is Avis. If I may interject here, I have a different perspective here on this, and I can speak to historically because I've been with the department 27 years. And so I can give you the history of how this came about, and Daniel and others, as far as why we tailored it to 2 mental health and 2 substance abuse needs per year. And then Ben is probably been around as long as I have, and I've been working with Ben Harrington a long time, and he could probably attest to this and also chime in on this as well. So first of all, let's start with the question at hand is why we only tailor it to 2 mental health and 2 substance abuse needs. I can tell you for sure, when we did not have a cap on it, I remember doing this needs assessment summary, and I kid you not, it ended up being about 40 to 45 pages. And that was not having a cap on it, probably could have been more. So at that point, when you're looking at the purpose of the needs assessment in developing a 3-year plan, this needs assessment summary, to prioritize it, priority 1 and 2 needs, was for the purpose of budget deliberation through, excuse me, through the Planning and Budget Committee. As our commissioners and executive leaders begin to review this and discuss what needs they wanted to present to the governor's office. At that point, the commissioner at that time indicated to us that, wow, we need to kind of pare this down so we will be able to know what the priorities are in each region. And a way to do that was to limit those needs in a prioritized format, as Kurt mentioned, in order for it to be manageable for the commissioner and executive leadership to have a conversation with the governor's office and the leaders in his office in a manageable format. So as time went by and commissioners began to use the needs assessment in their plan to discuss with the governor, prioritize needs for that budget, it ended up being cut down less than half and to be a manageable document. So this is the history of the needs assessment document, the history of the prioritization of that document and the reasons for it. So with that said, that gives you a little bit more history, but also Ben Harrington has been around as well and has helped in that process and shaped in that process as being the chair of the Planning and Budget Committee, in which this needs assessment is passed through in order to develop the 3-year plan. So with that said, then I would like to, as Mayor Nell said, Ben Harrington to interject his knowledge base on that and kind of take it from there. Thank you.
Thanks, Avis.
Thanks, Avis.
Well, thank you, Avis, for, I guess, putting me on a spotlight here. I do remember those wild days when we would have 19 recommendations coming out of Region 2. So I understand the need to narrow things a little bit. But what I will say is that the current process, while it does work, might also not necessarily give equal weight as might be necessary. You noticed that two mental health needs that were recommended from this region. One was a children's need and one was an adult need. And so when you get to the fact of having to narrow down to two, sometimes it works out where there's equity in terms of an adult need and a child need. And sometimes it doesn't work out when people are making recommendations. So, you know, we're doing the best we can with the way the rules are now in terms of two recommendations for mental health services and two for substance abuse. It does take into consideration the high volume of recs that we had in the past, but it may also be time to revisit, is two the magic number? Would it be more appropriate to have two adult mental health needs, two children's needs, and two substance needs? And, you know, so it's something to consider. And, you know, we can continue to have that dialogue, but it may also be something to consider through the legislative process too. You know, there could be the opportunity to increase the volume of ideas that are suggested that way. So East Tennessee has a history, though. We usually submit more of everything, whether it's legislative proposals, needs assessment recommendations, et cetera. So it's Region 4 and Region 2 that usually do the bulk of this work, I think.
Thank you, Ben. That's really a good point. Also, I want to share that we do have another piece to this in layers, as Ben talks about when you're talking about the Children and Youth Committee as well. Keep in mind, each region has a committee with a chair for and sometimes vice chair for the Children's Committee, but we also have a statewide committee. We have encouraged each regional council to have that committee chair sit on that statewide council to bring those needs forward. And so that may be also a part of the statewide Children's Committee needs assessment as they go through this process as well. So keep that in mind as well too. You can share that, put that on your agenda, but also the person on your as your chair for that committee shares that with the statewide. So it may end up on that need too. So you may have duplicates. Keep that in mind as well.
Mm-hmm.
Certainly. Daniel, I heard you say one other thing that we have not directly addressed in the responses, and that is, I don't know, I call folks peers, folks who are receiving services. Some, you know, consumers, patients, clients, I call us peers. So some of us on this committee are both working for an agency and consumers. So there is that, but I think we can do a better job of their involvement, their input, making ways for our peer communities to have input, to educate them about this process. And I'm going to go ahead and commit to that for the next year. So I invite everybody to reach out to folks who are receiving services and invite them to participate. And let's see if we can increase that. I know we have a goodly amount, but we do not have the number we want. So are we sure that we are not our own voices? That's the thing that we're listening to. So thank you, Daniel.
Hey, Mary, now this is Kurt. One other thing that I'd like to just crystallize, and I appreciate the feedback. Having one more need, having two more need, where does it stop? Where's the, as Daniel said, where's the appropriate amount? And that's all in the eye of the beholder. I'd like everyone, I'd like to share my favorite, everyone has one, my favorite Winston Churchill quote. It's very bureaucratic, because that's the world I live in, but it says, "This report, by its very length, defends itself against the risk of being read." And I think that's what we're up against. when you produce government documents, council documents, we want to make sure that the impact we had is something that is digestible and understandable, because we are competing with a ton of different interests for the governor and the legislators' attention. So thanks.
I absolutely agree, Kurt. Brevity is the soul of wit. I just think it sounds like the pendulum was too far, too big, too large, and so some small, very moderate, appropriate expansion should be considered. But anyways, thank you everybody for your time. I don't want us to talk anymore about this unless other folks want to. Thank you again.
This is Mel. I'm going to make one last comment here. Appreciate everybody's feedback. I think it may be worth a check into because we are coming and still in a pandemic to where dynamics have changed, that maybe there may be a possibility of an exception to submit possibly 1 or 2. I'm not saying 19, but because of the economic environment we are currently in with stimulus money and funding federally, and again, a lot of reaction as far as these issues being substantiated more because of this pandemic, I think maybe it might be worth just checking into, at least just for this year, maybe to add 1 or 2 more.
Thank you.
Thanks, Mel. We're at the end of this year's process, but thanks for that suggestion.
And I do have the vote. You know, the folks who submitted their 2 choices for mental health and substance abuse. So it would be something we could revisit pretty easily if that's what we decided we wanted to do. I am going to move on to legislative with Ben because I think this is a great segue. And we have the opportunity to hear about what's going on with the legislative committee, what some of the proposals are, and your opportunity to be involved with that, right, Ben?
Yes. Yeah.
All right.
The legislative folks are going to meet Friday from 12:30 to 2:30, and you should have all received via email from Mary Nell the legislative proposal form. If you want to put your idea into that form and send it to me, that would be great. Then the committee will review those and see if we need to wordsmith anything a little bit on Friday before we submit them to the state next week. So we need your good ideas, of course. The legislative suggestions, you know, they typically fall in the category of, is it legislation that needs to occur? And so you would need to understand a little bit about whether there's already something in existing state law or we need to tweak it or it's something brand new. If you don't know, it's okay to tell us you don't know. That's fine too. It's also okay to tell us if the change that you're seeking could be something that's achieved by rulemaking. So could it be our commissioner works with TennCare to decide on something, perhaps? So put your ideas into those forms, try to answer as best you can, and then send them to me. And my email is ben@mhaet.com, and committee will take a look at them on Friday. Thank you, Mel Whaley. I got yours that you sent me. Cheryl McCormick, I got yours this morning, so thank you. And I know there are several others that are, you know, in process. So.
All right. Any questions for Ben?
Mary, now let me tell folks what the timeline is there. They've got to go to the department next week, and then they will get before the executive and legislative committee of the State Planning Council, and then they get forwarded on to the commissioner for review and action as needed. Sometimes these do get passed along to the governor for legislative action for future years. Sometimes they get acted on internally.
And that meeting is going to be in person or virtual? It's virtual.
We're doing virtual on Friday.
Yeah.
Yep. And so if anyone wants to get an invitation, I'm happy to invite them and send them the link. So again, my email is ben@mhaet.com. So email me, tell me you want into the legislative meeting, and I will send it to you. Okay.
Thanks, Ben.
I know Jan's going to be there. Daniel's going to be there. Candace is going to be there from her.
Helen Ross.
Yeah, well, she's recuperating after some surgery, so but she's going to be there. Yeah.
I'll be there for a little while.
Yeah. Good.
Okay, moving along. You may have noticed that someone is missing, and it is our own Amy DeLinky, who had to step down as vice chair. Her term is not completed until June 20th. So we are accepting nominations for someone to serve in her position until the end of June. And then at that point, yeah, go ahead. I'm probably saying it all wrong.
Now, her term expires June 30th of next year.
22. Okay.
Yes. So the individual could serve interim in her role with plans of eventually moving into your role. But yeah, just wanted to clarify.
Thank you. Thanks for the clarification. Always muddling numbers. And so you would be signing up to be vice chair. What that has meant for the way Amy and I worked it out is that if I couldn't go to a meeting with the state, she was able to represent us. She also was involved in a committee, and for her it was substance abuse committee. If she's able to step in, if I step out, that kind of thing. And then, as you said, it is not a requisite that you continue the term to chair. There will be elections again, 6/20/22. But if you would like to submit your name as vice chair to finish out the Amy's term, I would gladly consider those. You can email those to me. Is that correct, Kirby?
Yes, if there's no one on the call right now interested in throwing their name out into the hat,
Okay.
you could express interest via email. You could do a vote via email. Yes.
Okay. Do we have anyone from the floor present who would like to submit their name for consideration? A long drawn out pause.
We have this happening in another region too, and it's the same.
Go ahead, Allie.
People like to think about it.
Allie's wanting to say something. You're muted.
No, I was just laughing.
The long drawn out silence because everybody wants to be
Laughing with sympathy, laughing with, not against.
That's okay. I'm still chortling. Okay, we'll get some folks to step up and that'll be great. Maybe I'll bake you a quiche. I don't know. I'm into quiche these days.
Jan has a message, says she'll serve as interim.
Jan? Are you being all quiet over there? Yay! Woo! All right, Kirby, you heard that one.
All right.
Yay, Jan.
Nice.
You're not familiar with this at all.
For those of you who are new, Jan's a former chair. So there you go.
So Avis, just to clarify, so, everything is different with this Open Meetings Act. So I just want to clarify, and Kurt, since Jan has agreed to serve interim in this role to finish out Amy's term, do we still need to have a vote?
Yes, we do. We need to have
Okay.
a vote. Her name has been submitted to the floor, so we need a vote, and that vote needs to be done this way according to the Open Meetings Act. Each person shall say yes, no, or abstain. State your name, yes, no, or abstain.
Point of order, do we need a motion to nominate Jan Kegel for the interim position?
Yes, absolutely.
So moved.
Seconded.
We need a second. There we go.
Daniel second.
All right, now Mary Nell, you can see if there's any discussion that wants to be made. So ask
Thank
that
you.
question. Anybody want to discuss this?
Is there any, is there any discussion around the motion for Jan Kegel to serve as interim vice chair of the Region 2 committee, EMP committee?
And then if you don't see any or hear any, you can say hearing none and seeing none, we'll proceed to a vote.
Hearing none and seeing none, we'll proceed to a vote.
And this
I
is
used
where
to do
Jan gets to find
commercials.
out exactly how many people like her, because it's going to be up and down vote for her. So now you just call the roll, Mary Nell.
Chris, can Chris do that?
Yeah,
Absolutely.
I'll do it.
Chris.
Let me get to that spot. Okay. Amanda Millsap. You have to say yes, no, or abstain.
Yes.
Okay. Now, Kirby, do I need to write down who voted what?
I mean, this will be recorded for your
Okay.
minute.
This will be recorded, but also put this in your minutes as well.
Okay. Now, Avis, do you vote or no?
Oh, since I'm a state representative, I have to abstain. I can't vote.
Okay, so I'll put you down in the minutes as abstain. Okay, Ben Harrington.
Oh, hell no. I mean, yes.
I don't think that was an option.
Thank you, Ben.
Now, Ben.
Oh, I meant to be on mute then. I'm sorry.
Now, Ben.
Yes.
Once again, censored.
Allison Price.
I think it's Alicia Price.
Oh, sorry. I keep calling you Allison. I'm sorry. Alicia Price.
Sorry, will you say that again? I had bleeped out just a little bit. I know you said my name.
We're doing a official vote for Jan to be the interim vice chair.
Yes, would love that. Thank you, Jan.
Okay. Brian Buck.
Absolutely.
Okay. Jan Kegel, I guess you can vote for yourself.
Can I abstain?
Karen Broadnax.
Yes, ma'am.
Okay. Allie Kahn.
I'm not sure if I'm a voting member of this body or not, but if I am, I vote yes.
Okay, I believe you are. I believe you submitted an application.
Okay.
Daniel Ellis.
I vote yes.
Okay.
Yes.
Heather Vestal. Heather Vestal.
I vote yes.
Okay. Gina Mac Steele. Steele. Why did I say that backwards? Sorry.
Yes, I vote yes.
Okay, Kirby needs to abstain. Kubra.
I can't vote. Sorry, I'm an MCO and I'm not a voting member.
Okay, so I'll put abstain next to your name. Kurt Hippel has to abstain. Sorry, I'm trying to write these as we do them. Mary Katsikas.
Yes.
Mary Nell.
Yes.
Okay. Mel Whaling.
100% yes.
Okay. Michelle Trofatter.
Yes.
Pam Dixon.
I don't think I'm a voting member.
Okay. Cheryl McCormick.
Absolutely yes.
Tammy Wilson.
Yes.
Okay. And then I have Tammy Summers.
Yes.
And then I've had another person added online that's an 865 number ending in 70. Who is that?
Hi, this is Amy Olson. I got disconnected. Yes, I vote definitely yes.
Okay. And then I'm Chris Roberts, and I vote yes as well. And that's it, Mary Nell. That's everybody.
Okay, well, it seems by unanimous vote approval of Jan to become the current vice chair, finishing out the term of Amy Delinky is passed. So yay. Thank you, Jan.
Yay.
Okay. Thank you, Chris.
Jan, I'll email you after this to finish out the process, okay?
Sounds good.
All right. I think our next order of business is to hear from Kirby, a state partner update.
All right. Let me pull this up. 1 second here. Okay, can you all hear me?
Yes.
Okay. So just a few updates since we last met in February. The February report, 3-year plan, year 2, fiscal year 21, has been completed and shared with regional council leadership. If you're interested in viewing this document, please contact your regional council chair or vice chair, which is now Jan, or me. The department, Ben touched on this earlier, the department would like to encourage the planning and policy regional councils to identify matters affecting people with mental illness, substance use issues, and/or co-occurring disorders that may require legislative attention in the 2022 legislative session. Legislative proposals are due to me by close of business on May 17th. These next 2 updates we'll hear more about in the future, but I just wanted you to be aware of them. The department will receive an additional $15 million from SAMHSA through the Community Mental Health Services Block Grant and $30 million for the Substance Abuse Prevention and Treatment Block Grant to assist in the response to the COVID-19 pandemic. States may use this supplemental COVID-19 relief funding to respond to needs and gaps due to the ongoing COVID-19 pandemic. The department will also receive an additional $687,000 set aside of the mental health block grant allocation to support evidence-based crisis systems. The 5% set aside will be used for evidence-based crisis care programs addressing the needs of individuals with serious mental illnesses and children with serious mental and emotional disturbances. Funds may be used to address some or all of a set of core crisis care elements, including centrally deployed 24/7 mobile crisis units, short-term residential crisis stabilization beds, evidence-based protocols for delivering services to individuals with suicide risk, and regional or statewide crisis call centers coordinating in real time. And lastly, Tennessee's emotional support line for pandemic stress is adding a new method for people to reach out for help. The free and confidential line now has the capability to offer assistance via text message. Tennessee healthcare workers, first responders, and all Tennesseans working in education, including educators and district and school administrators dealing with the feelings of stress, anxiety, sadness, or depression related to work, can now call or text the emotional support line at 888-642-7886 from 7 a.m. to 11 p.m. Eastern Time daily. Specially trained mental health professionals who answer calls or respond to texts through the line can provide emotional support through active listening, help identify and address basic needs, and provide reference tools for managing stress and making a plan for self-care. And that is what I have.
Great. Any questions for Kirby? All right. Thanks, Kirby. I believe now we're moving on to the subcommittee reports and updates for children and youth. Amy, I believe you have a report. Is that correct?
No, I was just going to update that we had sent in our needs assessment, but you already reviewed that. We concluded our meetings in March since we were done with our goals, and we will reconvene in the fall.
If anyone is interested in serving on your committee, they can connect with you.
Correct.
Okay.
And I really second that the virtual platform was fabulous. We had over usually 20 participants each time, and I think that was mainly due to virtual. So if we can continue that, that would be great.
Absolutely. Absolutely. I know that Candace is not here. I believe what we're going to hear from the adult committee would be that they worked on the needs assessment. Does anyone else who serves on the adult committee have anything else to report? No, that's pretty good work right there. And I know there's nothing from the Gina, you don't have anything in addition from substance abuse committee, is that correct?
That's correct. We haven't met since doing our needs assessment.
Okay. So these are the folks who are chairing, co-chairing committees. If you would like to get involved with those, participate in those committees on their good work, please reach out to them directly or to me if you need that information, or to Jan Kegel if you need that, or Chris Roberts, any of us be glad to redirect. So I think that's all for business. Am I correct, Kirby?
Ben does the legislative committee. Does he have anything else?
Do you have anything else, Ben?
No, ma'am.
Okay. Thanks, Chris. All right. Well, what announcements?
Wait a minute.
Wait a minute. Okay.
Yes, I got something y'all need to know just so you're rightfully unhappy as I am. How about that?
Oh, share the misery.
Yeah. Well, the good news is, of course, the state budget got approved with some significant additions. The great news was the Children's Mental Health Trust Fund got reinstated into the budget this year and got passed, which is wonderful news. Now, you need to understand how that's going to work. They're going to work off of interest income off of that money and allocate, probably around $20 million or less a year, depending on interest rates and stuff like that. So don't get too giddy about it. There'll be a process, and I don't think the process has been figured out yet. Now, the thing I wanted to mention that I think y'all might be concerned about is there was some behind the budget funding proposals that legislators filed. And one of which was the proposal for a 4% rate increase to the community mental health center providers. It was not included in the final budget. And what makes me very unhappy is the word from various legislators was really, oh, well, mental health got so much new money. They don't need it. So they were voicing concern that, oh, because of the trust fund, we didn't need, to be increasing provider rates in TennCare. And other funding that came to the department's area from federal grant funds, et cetera, also weighed into that notion of, oh, well, mental health already got all this other money. So where this really needs to get you unhappy is legislators clearly don't understand the various pools of money. The provider rate in TennCare is 2/3 of it is federal money and 1/3 is state money, and it's paying for clinical services in TennCare. The Behavioral Health Trust Fund for kids, it's got nothing to do with TennCare revenues. Or the block grant monies have nothing to do with TennCare rates that it pays folks. What you need to understand is when TennCare establishes a rate that it's going to pay a provider, then that provider is really handcuffed on how many people it can employ using those dollars, and thus that limits how many people actually can be served in any given day with that pool of money that Ridgeview gets or McNabb gets or Peninsula gets, et cetera. So you need to be concerned. And so if you get a chance moving forward, let's have the conversation with legislators about, you need to understand Medicaid revenues or Medicaid rates have nothing to do with any other funding that's out there. Those other funds are restricted and you can't necessarily commingle. So they just need to get some clarity, and they need to hear it from all of us. Now, the other thing that we need to also be concerned about is while that rate increase was proposed and the legislators were willing to sponsor the bill, it was not necessarily so equitable as a situation in terms of a lot of addiction treatment providers were not going to be included in any rate increase there. It was the CMHC, Community Mental Health Center providers rate increase. So any rate increase would have been good. We would have preferred to have some equity there, and we certainly did not want to have legislators be so misinformed that they didn't understand the two pools of funding were totally different. Okay.
Thank you, Ben. And, and I think back on our needs assessment of being able to attract employees, workers in the field. And if there's, if we're already limited as far as who's approved, getting approval for someone to come on board because of budgetary constraints, that just got nixed as well.
Yeah.
So, All right, I'm disappointed and really sad now. So now I need an announcement that's happy.
Oh, I got good news if you want to hear from me again.
I need to hear something good.
Okay. Two things. First of all, the Mental Health Association is going to start recruiting to hire a new peer support specialist. And sadly, one of our current staff is leaning to retire as soon as we can hire someone, if not by the end of the year. So we need to start that process to recruit a peer specialist. The second thing is we have a new full-time position we're hiring for, and that person will manage our mental health screening program from Chattanooga through Knoxville to Tri-Cities and coordinate all the various marketing components of that and promote it to media and corporations and churches and all sorts of places.
All right, wonderful. Thanks, Ben.
Thank you.
Daniel put in a chat comment, and he said, I can't read all of it because I'm old. It sounds like a low TennCare reimbursement rate directly affects how many people a provider can serve and thereby impacts network adequacy.
Is that correct?
Well, no, if you're a community mental health provider, we get penalized if we can't get TennCare patients in for an intake within 2 weeks. It doesn't matter if you're booked out solid and your intake is 6 weeks, a month out, 7 weeks, you are going to be penalized for that. We can't afford to hire new staff because the budget hasn't increased, but we still have these, stick beatings every time we fail to get a TennCare patient started in services. Ben, you want to say more about that?
Yeah, well, TennCare rates directly connects to the amount of compensation a provider can pay their employee. And, we all know, everyone in this meeting today, no one's getting rich going to Tahiti for month-long vacations. That's just not a reality. But the problem is people do work for a time at a community mental health center or hospital provider, and then a lot will migrate outwards to the private sector because they can charge a totally different rate. They can charge what the market's gonna bear. They can take cash. They can avoid insurance paperwork and all that stuff. Okay, so the issue really is community mental health center providers, public sector providers are hamstrung by their reimbursement rates and hence how much they can pay that particular person to work, whether they are a physician, a nurse, an LCSW, a LADAC, a CPRS, a LPC, et cetera. They are handcuffed. And then that further constricts how many they can actually employ, and that constricts how many you can see in any given day. And then if the employer has a vacancy, that constricts it even further.
Thank you. It's not good. Thank you, Daniel.
Yeah.
All right. Okay, other announcements. What's going on? I know things are starting to happen.
I'll do a brief thing. We don't have registration open yet, but we're probably about 2 weeks from opening registration for the 2021 10NAD conference. And we're doing it virtually again this year. And something that we noticed, we had a board meeting this morning, is by doing it virtually again this year, we're able to bring in more speakers from out of state. So that's a financial advantage, but we're getting quality speakers. And as soon as I have that together, Mary Nell, I'll send you the information to distribute to the group. What we're looking at this year is, it's interesting because of the pandemic, kind of how people in our service system look at it is the pandemic actually highlighted weaknesses systematically that were already there, but the pandemic just highlighted them more. And looking at that, and we've got a lot of family members speaking at this year's conference, which is a good thing, and getting their perspectives on what needs to stay the same and what needs to continue changing. So I'll get that information to y'all.
Wonderful, thank you.
Hey, Mary, no, this is Kurt. I don't have an announcement other than I turned 39 last Friday.
Happy birthday! I think we celebrated your
Thanks.
birthday at one of these meetings.
You did, yeah. You brought little cupcakes and it
Yeah.
was great. But I have more of a
Oh, yes, I
question than
remember.
an announcement. And y'all don't have to answer it now, but just at some point we need to get a sense from the different regional councils if they want to continue doing electronic meetings, if there is some good reasons for doing that. So as y'all move toward your next quarterly meeting, it might be worth kind of kicking that question around in your head. I know that vaccines are readily available. A lot of people are starting to get those and become fully vaccinated, but would like to know how y'all. We're going to try to reach out to all the chairs, I think, or do a survey of the chairs, just to kind of get a sense of where each community is on their on whether they need to, whether there is a need to continue with electronic meetings. So want to put that out there. We definitely want to get y'all's feedback, and we can take that into consideration as to what steps we take going forward on that.
Okay. Maybe we can just do an email kind of vote and conversation about, maybe having one gathering a year so we get some community engagement and opportunity to physically be together, and maybe other, so all kinds of possibilities. But I'll send maybe a email out about your thoughts on that going forward. Thank you. Other announcements? What's going on? Isn't anybody from NAMI on here?
Well, I am here. I can talk on their behalf if there's nobody else. They had the Vision of Hope Awards last night. It was a virtual award ceremony, which was very nice, NAMI, Tennessee. And I joined and watched it. It was really, really nice. They did a great job. It was disappointing for the award winners because there wasn't anybody in the hall. They went to, where was it? It was in one of the museums downtown Nashville. So like the Campbell Museum or something. But it was very nice. And they are going to have conference this year again. That's all I know. I'm not on their board or anything, but that's the brief, what I'm watching in the community.
Thank you. I know there's a virtual NAMI walk coming up.
Yes, on Saturday. Yes.
Saturday.
Yeah, that's in Knoxville. Yeah.
Yes. Thank you. All right. Well, our next meeting is going to be August 11th. And I suppose between now and then, we'll figure out what our format is going to be as far as in-person, hybrid, or all virtual again. So I'll be taking those comments and pondering all of that to make plans going forward. Is there anything else, Kirby?
I don't have anything else to report.
Okay. Well, I will entertain motions to adjourn.
So moved.
And a second? All right, I read his lips. Okay, Ben seconded. Okay, everybody be safe. Thank you for participating and all your work in the community. Bye.
Thank you.